The healing of bone fracture. This is the objective of today's lecture. What are the steps, the progressive steps that take place that lead to the eventual healing of a bone fracture? So, in this lecture, we're going to talk about what are the progressive steps that unfold and take place in this direction. So, this is a broken bone followed by multiple progressive steps that lead us to have this healed uniform bone structure, this healed uniform bone tissue. So before we get ahead of ourselves, let us discuss what is actually the let us discuss what is actually bone fracture before we discuss what is bone healing. Okay, bone fracture is a discontinuation in the integrity and the continuity of bone structure as a one piece. So even though we do have joints where more than one bone articulate, but we need to have one whole bone, one whole piece of bone that articulates with another one whole piece of bone. So if the continuity and the structural integrity of the bone is broken and there is a fracture, then your body is overtly concerned with the repair of the continuity of the bone. We need to have the bone as a one piece. There are different kinds of fractures. There is a fracture that is an open fracture to the point where there is a breakage in the bone that even cuts outside to the skin. So that's an example of an open fracture. Sometimes there is a fracture like a displacement. So the bone is not entirely broken, but it is partially broken. That is fracture. So we don't need to have a complete fracture to say that the bone has been fractured. Partial fractures also do exist. And we have comminuted fractures, comminuted, COMMUNITED, comminuted fractures. These are fractures where when the fracture happens, there are fragments of the bone. So there's bone powder, there's bone fragments like glass. So the bone is not broken evenly. So bone fracture is very important because it is the number one pathology. Bone fracture is the number one bone pathology. If you are in orthopedics, rest assured that the number one bone pathology will be bone fracture. That does not mean, as an orthopedic, you will never going to be dealing with bone tumors or bone infections. They do exist, but they are incomparable in terms of prevalence and incidence to bone fracture. So bone fracture is a really big word, but there's a lot of different kinds of fractures that we alluded to, these open fractures and comminuted fractures. But these are not the topics of today. The topic of today is once the fracture happens, irrespective of what kind of fracture that is, what are the steps that lead to the restoration, to restore the bone integrity and the bone continuity as one piece? Okay, so the first step that happens in about the onset of the fracture, referred to as zero. So that is the onset of the fracture till about the first day to 24 hours. What happens here, this is known as the stage of the organizing hematoma. You see this alarmed red blood clot. There is a blood tumor. That's like a blood tumor. There's a blood swelling, blood clot. This is known as a hematoma. That's a blood clot. That's a blood tumor. That is this blood tumor. Where is it? Is it where the bone is healthy? And no, it is exactly around the fracture. And you know where that blood came from, obviously. The bone tissue is full of and is invigorated with blood vessels. You know, this bone tissue is a live tissue. It needs oxygen for oxidative phosphorylation, for aerobic respiration. This bone tissue is made up of cells. So cells need oxygen. They need carbohydrates for metabolism, they need the lipids, they need their proteins. So we need to have our conduits and we need to have our blood vessels going through the bone tissue to provide it with what it needs, and also to remove all the metabolic waste that piles and builds up in the bone tissue. So when there is a fracture, these tubes, these blood vessels rupture. So when they rupture, a lot of blood spills around the fracture. So there is a bubble. There is a bubble of blood right around where the fracture happened. And this blood that is right around where the fracture happens is like jelly, is like a really thick coagulated blood. Coagulated. Coagulated. This is a coagulated thick blood. This thick blood is, first of all, going to provide like a cushion around this broken fragment in our fractured bone. In addition to that, the blood vessels are going to start to sprout. You're going to have blood vessel sprouting. They're going to start to sprout through this jelly blood hematoma. We need to now stop calling it blood tumor and a blood clot. We need to refer to it with its real name, hematoma. When you say hematoma, now we already know what that is. That's a blood tumor, blood clot, blood coagulation, blood spill jelly around the site of the injury. And you know, now, this is inflammation. So there is a lot of redness and heat, and there's pain, and there's swelling, and there's loss of the function in this broken area. So a lot of, there's an immune response now because all of this, we're going to have a lot of macrophages that are going to come to remove all the necrotic debris, all the broken bone tissue that needs to be removed from the area of the fracture. And there is a lot of macrophages who are going to remove all of this piled up tissue, necrotic debris, to pave the path for healing. So we don't begin the healing first. We start with an inflammation following this hematoma, and all of these cell eaters, those phagocytes, those macrophages, are gonna arrive, through these blood vessels to the site of the inflammation, and they're going to respond to the cytokines that are going to be secreted like crazy around the site of the fracture. And the cytokines are going to recruit a lot of immune cells, a lot of macrophages who are going to clean and remove all the necrotic damaged tissue, broken fragment tissue, and remove all the bacteria. And then the blood vessels are going to start to constrict to reduce this blood. We don't want to have a huge hematoma. We don't need to have an intravascular hemorrhage. We don't want to have an internal hemorrhage. So these blood vessels are eventually going to start to squeeze to prevent blood loss. Then we're going to move on to the next stage. So first stage, from the onset, 0 to the about 24 hours. That's the first day. That's known as the organizing hematoma stage. The next stage is from that first day to about 2 weeks. So what happens here, now you see, now there's no more redness. You see the gap is still there. You see you have the two islands and the ocean in between them, two islands and water in between them. But here we're going to learn how this gap is going to be bridged. So now we need to start to deposit and build new bone tissue to bring these two friends together. They used to be one piece, but because of the fracture, they got separated. So now we need to restore them together. So, what are the things that happen? So, number one, what do we have here? We have inflammatory cells. This is no surprise. We're always going to need the police. We're always going to need the immune cells. You're going to need your macrophages. These macrophages are going to come to constantly ensure that there is no necrotic debris, that there is no infection, that there is no opportunistic microbial infection, because the microbes, your bacteria, and your these infectious microbes, they love this kind of environment of inflammation, and they love this kind of environment of injury, and this environment of damage. So there's always going to be inflammatory cells. The platelet cells are there to ensure that we have stable blood supply. We do not need to have, they are like band-aids. So these platelets, they are like band-aids. So they are there to ensure that we have blood stability, we have hemostasis. We do not lose too much blood because we're done with the hematoma. So these are the guys who prevent. These are the band-aids. The platelets are these green platelets are there to stop the blood loss. Also, the inflammatory cells and the platelets, they work together to cause, we mentioned the cytokines. Cytokines are like messages. These are like alarming messages to alarm and alert the body that there's a fracture, there's inflammation, there is damage. So what they do is these platelets and the inflammatory cells, in addition to their original functions, they initiate platelet derived growth factor, PDGF. That's very important. PDGF, that's the first one. Platelet derived growth factor, PDGF. Number two, we have the fibroblast growth factor. So they all end with GF. You see, there's a common denominator: PDGF, FGF, TGF beta. So they always have a GF. What is this GF? So GF is growth factor. So factor is a cytokine. So you have different kinds of growth factors. So you have platelet derived growth factor. Oh, so now we know where it came from. It came from the platelets. So the platelets gave us platelet derived growth factor. And they gave us fibroblast growth factors. And we also have transforming growth factors, TGF beta. So these are the growth factors that are going to help with healing, that are going to help with dumping a lot of fiber and initiating, the cartilage. So we have chondrocytes. Chondrocytes, site is the cell. Remember, from cytology, ology, learning, psychology, the science of um, the consciousness. And you have the sociology, the study of the community. And then you have your cytology, the study of the cell. So here, when we look at chondrocyte, so that's site is a cell, CYTE, not SITE, CYTE. So these sites, these are cells. Chondro, so these are the ones who make for us our cartilage. So the chondrocytes are gonna start. So we have progenitor cells. These are dormant cells. These are dormant cells. And once they get activated, they start to dump. They start to vomit a lot of chondro, a lot of cartilage. This cartilage is not going to stay cartilage forever. It's going to, in the next stage, become bone. So cartilage is going to become bone. So now the cartilage is going to get vomited and secreted by these chondrocytes and these platelet derived growth factors, and the fibroblast growth factor and the TGF beta, the growth factor from the transforming, from the fibroblast, are all secreting for us a meshwork, a fluid that is thick but is not as strong as bone yet. So that is in the second stage. In the third stage, That is known as the bony callus. So you see this red tissue? Now this is known as woven bone. That's very important. Woven bone. Woven bone is the type of bone that is now you're gonna have recruitment. So I forgot to talk about these two cells. So we talked about the platelets and the inflammatory cells. They're always secreting growth factors, and these chondrocytes secreting a lot of cartilage. What about these two cells, the osteoclast and the osteoblast? You see, there is an orange arrow that points. You see, it crossed the river. It crossed over. They crossed from one side to the other side. Well, what are osteoclast? What are osteoblast? So osteoclast, clast with a C. Osteoclast, class with cut. So these are bone cutters, bone breakers. They are like jackhammers. They cut and they break down bone. They make bone like powder. They crush down the bone. Bone is like mountain. They crush it down. While osteoblast with B, blast, so they build up the bone. The osteoblast build up the bone, while osteoclast cut up the bone. That's why when you look inside the cell, there is a very subtle clue. The osteoblast has a one big round nucleus. That's signifying mitosis. So they build up. Osteoblast with a B build up. So they have a nucleus. So the nucleus does mitosis, and then you have a cell division. So the osteoblast build up for us the bone to bridge the gap. While osteoclasts, they don't have one big nucleus. They have knives, one, two, three, four. They have enzymes. They have metalloproteinases. They have degradative enzymes. They have all the weapons, reactive oxidative species. They have all the acid, hydrogen protons. They have metalloproteinases. They have degradative enzymes. They have proteolytic enzymes. They are scratchers. They have a lot of weapons. But the osteoblast doesn't have any weapon. It just has a nucleus to build up. So these two guys, the osteoclast and the osteoblast, they are antagonists. So remember, in the past, we talked about calcium homeostasis. When there is too much calcium in your body, that's hypercalcemia. That's very dangerous. So what happens is the osteoblast, they are bone builders. They will start to take the calcium that is too much in your blood. There's too much calcium in your blood, the hypercalcemia. They will start to take too much calcium from the blood and throw it in the bone and store it in the bone. So these are the osteoblasts. But in the opposite case, when now you're no longer suffering from hypercalcemia, now you're suffering from hypocalcemia. Calcium level has dropped. So now you cannot use osteoblasts because osteoblasts are going to take calcium from the blood and dump it into the bone. Now you need the opposite. You need to take calcium from the bone into the blood. So you need your jackhammer. You need the jackhammer like the construction to start destroying the bone and crush all of the calcium, throw it into the blood. So what's going to happen in here is that it's very important for us to realize that osteoclasts are, so since we are trying to heal the fracture, why do we need to use the cutters, these jackhammers? Why do we need to use osteoclasts? Because we need the osteoclast to remove the old, worn out bone tissue, and then the osteoblasts are going to come and build up the new fresh tissue. Okay, then you're gonna have this woven bone. The woven bone, you're gonna have this the initial tissue. You're gonna have tissue here in the middle between the two bones, known as soft callus. Callus is non-calcified. Callus, it doesn't have calcium. It's just a mixture like toothpaste. It's just like a liquid, gooey, some kind of thick um, um, some type of thick tissue that will later on become hard. So you see, this is the soft callus. Then we move on from soft callus into bony callus, woven bone. So woven bone is really when the really this soft callus starts to get hardened. You know, when you turn the milk into butter. So now this soft callus is getting thicker and thicker, almost becoming bone, but not yet. it didn't yet become bone, but it's getting thicker and thicker, and that is known as woven bone. So this red bone is a product of endochondral um, ossification, and you have this hyaline. Hyaline is like glass. When you say hyaline, that's glass. So hyaline cartilage is when you have the deposition. You have deposition of woven bone, and this woven bone, this red bone, is like closest to the bone. It's not yet bone, but the next stage is when the woven bone. Now we move on to the next stage, which is after the 2 to 3 weeks of the injury. That's going to become three to about 3 weeks to about a couple of months, and then you're going to have the successful. You see now the all the woven red bone has been converted into really thick tissue. So now we have restored the continuity of our bone tissue. So our bone tissue is now a one whole piece. There are very important factors that determine how fast our healing is, how healthy you eat. If you eat healthy, the more healthy food you take, the more healthy you are, the faster the bone healing will be. If you're suffering from obesity or malnutrition, both are bad. Obesity is a form of nutritional imbalance. That's stressful nutritional imbalance. And malnutrition is also stressful nutritional imbalance. So then the bone fracture healing is going to be delayed. Also, diseases like diabetes. So patients suffering from diabetes or suffering from chronic debilitating diseases usually have a big problem, in their fracture healing. Also, the senile, so the really old people, it takes their bone a really long time to heal. And you must also be very aware that there are a whole class of fractures known as pathological fractures. So not all the fractures are caused by trauma. People think that bones get broken because of a road traffic accident, or because you fell on them, or because you got hit by mechanical damage that led to the bone breakage. Yes, that is one category. But there's another category where the patient is never been through a road traffic accident or some form of trauma, but it's because they suffer already from some form of a disease like cancer. Then their bones get weaker, or osteoporosis. Their bones get weaker. Menopausal osteoporosis. When women, the elderly, and due to the loss of the estrogen, which has a very strong impact on bone density and peak bone mass, when they start to lose the estrogen, then the bone mass gets weaker and osteoporosis sets in, causing stress in the bone and weakness in the bone, leading terminally to bone fracture. Also, men suffer from um, there is a menopausal osteoporosis, and men also suffer from senile osteoporosis. So the men who are really old, their bones, also due to the loss of the estrogen hormone, they also suffer from weakness in the bone integrity. um, so it's very important to now recap. So let's see if we can recap. Okay, so let's now recap. It's very important to recap the objectives of today's lecture. Okay, okay. So what do we have here? Here we have our here we have our bone, and we said that onset of the bone, from the onset of the bone fracture up to the 24 hours, that's the stage of the organizing hematoma, and you have like a hematoma is a blood clot around the damaged tissue. We see this damaged tissue, yeah, it has a lot of blood vessels, and then the blood is going to be surrounding this hematoma. Then after that, the immune cells are going to remove all the clotted blood, and the blood vessels are going to naturally constrict to prevent any further blood loss. And then you have your inflammatory cells who are going to the inflammatory cells are going to come in and going to remove all the necrotic debris. And they're going to, and you have your osteoclast and your osteoblast working together to osteoclast cutting all of the necrotic debris and all of the old worn out tissue, while the osteoblast building up new tissues. And you have the progenitors dormant chondrocytes secreting a lot of cartilage. And then that moves us from this soft callus stage, from the soft callus stage into this woven bone stage. And you have about um, which is 2 to 3 weeks after the injury. And we move from soft callus into the bone callus stage. And then you have the woven red bone that is later on going to be converted into this bone tissue that is a completely healed bone.